Hi guys, we are going to talk about newborn respiratory, specifically respiratory distress in our newborn. So when we think about newborns and their respiratory status, we're going to remember that when babies are born, we need to establish the lungs as gas exchange because the babies have been getting all of their oxygen through the umbilical cord before delivery. And so when the baby is being born, the baby's body releases catecholamines that tells the fluid to get out of the lungs. Because remember also that amniotic fluid has been going in through the alveoli through the whole pregnancy, and that's actually an important part of lung development, but now it needs to get out. So the lungs are told to clear out, and the baby, as it's delivered and it's going through the birth canal, it gets a nice squeeze on the chest, and that also helps to clear the fluid. And then the baby's born and they take their breath, and then now we're establishing the lungs for gas exchange. Okay. If we don't get a good squeeze on the chest, sometimes we can have less fluid clear out. So we call that an inadequate fluid clearance. And so certain things can cause that, such as cesarean deliveries or precipitous births where they don't get a good chest squeeze. So those babies might not have cleared their lungs out as well. All right. Another thing that can happen can be if there was meconium in the amniotic fluid, then that can also be in the lungs. And if that happens, that actually is pretty bad because that is going to interfere with gas exchange. And those babies, it's called meconium aspiration syndrome, can develop a pneumonia. All right. So the things that we're thinking about when babies come out and they're starting to breathe is we're watching for signs that they're having difficulties. And one of the main things we'll see with this is tachypnea or fast breathing. And tachypnea is going to be if their respiratory rate is greater than 60. And we want to assess this for at least 1 full minute because babies' respiratory rates are irregular. So they can have really irregular breathing and sometimes be breathing really fast. Other times they might not even take a breath. They can have respiratory pauses or apnea for up to 20 seconds, and that's considered normal. So once we are assessing and we see that their respiratory rate is greater than 60, we're also looking for other signs of respiratory distress. And so the other things we might see, one of those things is nasal flaring. So their nostrils can be kind of coming out when they breathe. Grunting. Grunting is a sound that you hear as they breathe out. So it sounds kind of like a hum, and they're working hard to get the air out. The other thing we can see is retractions. And so we can see retractions in a few places. We can see them up here by the clavicles, we can see it down below the sternum, and then we can see them in between the ribs. And so if these are sucking in while the baby's trying to breathe, that's also an indication of respiratory distress. So those are the main things we might see. And if we're seeing those things, then we need to start thinking about why so that we know how to manage it the best. Oftentimes, if we have that inadequate fluid clearance, we're seeing tachypnea as our main sign. And with babies that have inadequate fluid clearance, sometimes they can have what's called transient tachypnea of the newborn, where they're actually breathing really fast, sometimes as much as 100 breaths per minute. And so these are all related to not getting enough fluid out of their lungs. So the way that we can deal with some of this is going to be by helping them clear the fluid. And so we can encourage our baby to cry. We can stimulate the baby and get the baby to cry, and that will help clear that fluid out. Depending on what our cause is, if we have a baby that is premature, then and they don't have sufficient surfactant, or your patient that is diabetic, who those babies also might not have sufficient surfactant. Remember, because the diabetic mom is giving baby so much glucose, and the baby's body is making a lot of insulin, and that can decrease their surfactant production. So both preterm babies and babies born to diabetic moms have an increased risk of respiratory distress for that reason. Those babies might need some pressure support. which we call CPAP, continuous positive airway pressure, where it just helps keep those alveoli open when they breathe out. They still breathe on their own. So these are a couple of things we can think about to do to try to help our babies that are having difficulty either clearing their fluid or things like that. So we can use wet frog as an acronym to help remember our things: wheezing, effort, tachypnea, flaring, retractions, oxygenation, grunting. For oxygenation, I'm thinking about color. I'm thinking about, is the baby cyanotic? Now remember that their hands and feet can be discolored, and that is a normal finding. We call that acrocyanosis. But if centrally they are blue and their mucous membranes are discolored, then that baby is definitely having a respiratory issue. So that's another thing to consider. And I think that's all for babies and respiratory.